filler migration is if you have filler in your lips and then over time it goes into the tissue above. This can be done because you have too much filler, and I always refer to lips like a glass. You can have a small glass, a shot glass, you can only pour that much volume into it, and you can have a bigger glass like a pint and you can pour a bigger volume into it. So depending on the anatomy of your overall shape of the lips, you can have small lips, you can have bigger lips, they can take more filler or less. Now the problem with lips is it's a muscle. So this glass is not just static, but it changes in size, and if the lip muscle engages, let's say you pout because you want to kiss somebody, it squeezes on the product and then more product is likely to migrate into the areas. Now I do a ton of lip surgery and I have seen a couple of lip lifts where I literally cut underneath the nose and I saw filler there migrating all the way from the red lip up there. The question is now, do I always have to get rid of the filler? And the general answer is no. It's a case-by-case, individual choice-based, it's an individual case-based, The general answer is no. We have to make the decision on an individual case basis. In some patients, I prefer to keep some of the filler. In some patients, all the filler has to go. Depends on the shape of the lips, depends on what you're trying to achieve, depends on the age of the face, depends on any kind of area. So don't think that once you've had filler and you're thinking you're going the route of facial aesthetic surgery by means of lip surgery, everything has to go. You have to find a surgeon that understands the benefits of keeping some of the filler. As a rule of thumb, the filler should stay at least 6 months before having surgery. Any fresh filler has still a risk of migrating. Anything after 6 months is more likely to less migrate and can be actually used in our benefit if we are thinking of keeping it for lip surgery.